We want to know when to see a psychiatrist and when not to. I think a common misconception is that psychiatrists carry out regular therapy. So psychotherapy is when somebody sits with a patient for a structured amount of time, usually 1 hour per week, or sometimes group therapy. So the vast majority of psychiatrists do not do this. Psychiatrists like myself, we're doctors first, so we have to complete all of medical school, and then we train in the medical aspects of mental health, such as diagnosing, prescribing medications. I think it's confusing because some psychiatrists, a small minority, then after that, they choose to specialise in psychotherapy. However, this is not common. A psychologist doesn't study medicine holistically like a psychiatrist does, and they only specialise in thinking and emotion rather than the physical human body. So, for example, they can't prescribe, but they do have expertise in long-term talking therapy. So they're the ones, not the psychiatrists, who sit down with a patient on a regular basis. They talk about emotional issues. So psychiatrists generally wouldn't see a patient as frequently as a psychologist, like on a weekly basis, unless that patient was going through an acute crisis. And psychiatrists' appointments are generally much shorter. So psychiatrists deal in mental illness, such as depression, schizophrenia. Psychologists sometimes deal in mental illness, but they can also deal with emotional problems that are not related to mental illness, such as family therapy, couples counselling, sports psychology, confidence building, anger management. So all of these things that are not definable mental illnesses. There are, of course, many other differences between psychiatrists and psychologists. I might do a separate video on this. Tell me, viewers, if you're interested in seeing this, let me know in the comments. Having said all that, a psychiatrist can refer to a psychologist, and they often actually work together on the same team. So if a psychiatrist thinks this person doesn't need medication, doesn't need hospital, but they need talking therapy to deal with emotional problems, they might refer them to a psychologist. So just to kind of reiterate, you should only see a psychiatrist if you think you have a mental illness, bipolar, depression, schizophrenia, as opposed to just an emotional problem. In the same way that you'd only see your family doctor if you were actually ill, as opposed to like lifestyle issues like losing weight or improving your diet or dealing with your stinky breath, which we both know has been an issue for quite some time. Hello, cruel world. What you just saw there was a tiny little tantalising taste, kind of nutty, of a much longer episode. You should go check it out if you're interested. The link will be in the description below. If you're a fan of either true crime or mental illness, or the crossover between the two, then you've got to go and check out my main YouTube channel, A Psych for Sore Minds. My name is Dr. Sohom. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. My channel covers a whole range, a smorgasbord of topics related to true crime and mental illness. For example, high-profile true crime cases with my own kind of personal psychoanalysis of individuals. I discuss issues related to criminality. I discuss individual diagnoses. I give advice about psychiatric problems. I interview ex-patients. I do a lot. There is something for everybody on my channel, and I implore you to go and check it out. You can even steal some of my ideas, palm them off as your own to impress your friends and impress people at dinner parties. It's all good. I've got your back. Until next time, stay euthymic, check out my channel, and please do not forget, I love you.